Cancer care is an interesting field of medicine because I think that it's progressing very rapidly. There's a lot of developments in molecular medicine and molecular targets, and there's a lot of innovations in surgical techniques that can be used for cancer care as well. So I think the combination of those made cancer surgery a really interesting field for me. There are some newer minimally invasive approaches, so we may be able to use laparoscopic or robotic approaches where there are smaller incisions, and this may help with a faster patient recovery, slightly less wound complications, or slightly less problems with pain. And so whenever possible, I like to consider whether those options are appropriate for a particular patient. I think the best thing about being a cancer surgeon is finishing the day and feeling like I made an impact in someone's life. Whether that was doing an operation where I feel like I got all the cancer out of them, or I'm rounding on a patient, visiting them at the end of the day and seeing them progress and almost ready to go home, or having a patient come to me in clinic after it's all over and say, "Thank you so much for what you did. It made a huge difference in my life and my family's life." Or even at the end of a clinic visit, when someone tells me, "You explained that to me better than the last 3 doctors I've visited. I understand what's going on with me now." I always like to keep in mind when I'm seeing patients, how would I want to be treated, or how would I want my family member to be treated? And try to keep that in mind with every approach that I have and every encounter that I have with a patient, as well as making sure that my team also reflects that. And I think that it's important that patients understand that we do work as a team, and that they may not be seeing me, they may be seeing other members of the team, but we all work and communicate together, and making sure that the patients understand that they're part of our team, and together we're working to make sure that they have the best care possible. I'm Jane Way, a surgical oncologist with Riverside Surgical Specialists.